Hello, this is Sithi Samani and today I'll tell you about the pulmonary tuberculosis. Okay, so what is pulmonary tuberculosis? We'll see in the further slides. Okay, now firstly we see what are the incidents in the whole world. So on the survey we have found that 1/3 of the population of the world is infected in the world. Okay, about 1/3 of the population in the world is infected by this disease, but the people are unknown because amongst that 5% has active disease and the rest 95% are in the dormant stage. What did this mean by the dormant stage? In this, the bacteria, that is which bacteria affects the tuberculosis, that is the Mycobacterium tuberculosis, these are present in the person's body and they are in the dormant stage. They do not produce the symptoms as if they are present, and if any triggering factor is present, then they will start to show the symptom, but now they are not showing the symptoms, so they are said to be in the dormant stage. In about 95%, the disease, the TB, is in the dormant stage, right? Okay. Now, the bacteria, the causative organism responsible for the tuberculosis is Mycobacterium tuberculosis, as you see on the slide. Now, what happens? Infection initiated by the inhalation of the bacteria present in the surrounding in the form of the droplets. As we know that as we cough, the droplets spread to the distance, right, and they can live in the environment for a very long period, about hours and hours. So from that droplet the infection initiated, and as we breathe it gets inside our respiratory system. Okay, now what is the pathophysiology? What pathology gets occur if the Mycobacterium tuberculosis enters in our body? These bacteria are taken away by the macrophage but manage to survive inside. What happens, as I told in my previous lecture, that every system have their own defensive system. As such, the respiratory system has the own, right? What are there? There's a nose hair, then cilia, that is mycociliary escalators, then the coughing, and the our own immunity, right? So these macrophage are included in the immunoglobulins, our immunity, that is WBC. What does they do? They try to eat that bacteria, but these bacteria are so naughty, so rigid, that they even survive in the macrophage, right? Then what happens? This there occurs an internalization of these bacilli, triggers an inflammatory process that brings other defensive cell to the area. So these bacteria present in the macrophage, what does they do? They do internalization, and after that our body gets a message that something is wrong at there. So the many cells comes there to correct that situation, right? So the inflammatory process takes place, and what happens, this inflammatory process, this cell causes the mass of tissue, all the cell gets combined, right? And what does all the cells forms? Tissues. Now these all cells which are surrounded at this situation, at this area, they forms the granules, right? This mass of the cells called the tissue, which forms a granuloma with the caseous necrosis, as cheese like structure at the center of this granuloma, can remain. Okay, now what happened? This granuloma can remain alive for the decades. This for thousands of we don't live for thousands of years, but for the decades this remains alive as a dormant stage. As I have told in the previous slide, that 95% of the people, the TB is present in the dormant stage, so it is present as it is without producing any symptom. But if any triggering factor like active pulmonary diseases, aging, which I will tell you in the next slide, what are the triggering factors that provokes the bacteria, this Mycobacterium tuberculosis, to be in the active form. I'll tell you the next slide, and there it becomes active. Okay. Now, what are the triggering factors? What are the factors that provokes the dormant state bacilli to be in the active form, right? So these are the five that immunosuppressive drugs. So as we take a drugs of the different diseases having the property of immunosuppression, that drugs lowering of immunity, as our immunity is very low, so these get activated. AIDS, in AIDS we know that the immunity gets reduced, right? Gets reduced low. So in AIDS also the TB can occur. Aging is the important factor. As we grow old, right, the immunity of our body gets decreases, so we are more prone to take the tuberculosis and the malnutrition. Now, what are the symptoms that occurs in the active form of the TB? So that is cough, night sweat, fever, weight loss, and coughing of the blood. This you will see that night sweat symptom, you will be seen in any kind of the TB, pulmonary TB, or the TB occurs elsewhere other than the lungs. So this night sweat will be there, fever will be there, weight loss, as a person will reduce the weight, as you have noticed the symptom in the AIDS patient, right? And the coughing of the blood, as we cough, the blood comes out. Okay. Now we'll go further on the what complications does this do. What happens when the TB occurs? What happens when the pulmonary TB occurs? So it then transmits to kidney. What happens there? Sterile pyorrhea, meninges of the brain, that it cause meningitis. On the lumbar vertebrae area, it cause the Port's disease. In the adrenal gland, it will cause Addison's disease. Liver, it will cause hepatitis. Cervical lymph node, it will cause lymphadenitis. So the infection spreads from the lungs to the different area of our body, so it's very harmful, right? Now, what are the diagnosis and the treatment of the pulmonary tuberculosis? So this is what are the diagnoses? That is a sputum examination, as we have to give sputum to the lab for the culture to see what bacteria is present or else. Then we will go for the bronchoalveolar lavage, in which the tube is passed in our trachea and to see and secrete some secretions, and then it takes that secretions and come back, so that what we can see in the microscope what actually is the condition in the lungs, right? Now the treatment, antibiotics is most commonly, this isoniazid is taken. It has the course of about 6 to 9 months, and it's compulsory to complete the course. It is very important to complete that course. If you leave this course in between, your TB will not cure, right?